Everybody will have chest pain or abdominal pain. Is it heart attack or is it gastritis? We'll discuss about it. See, normally, these are the things when people place their hand on their chest. As you can see, this woman placing hand on the chest, thinking this is a heart attack. The same thing, you can see elderly man placing a hand on the chest like this, and he's obviously looking tired. So, this is can be heart attack or gastritis. But this symptom or the sign when the patient, you see patient like this is most probably a heart attack, and this is unlikely to be a heart attack in young age. That is the main difference. So how do you know whether the patient is suffering from chest pain or this thing? See, always remember, heart disease or heart attack is caused because the blood vessels will be blocked, and this problem is not going to occur in the young age. Usually occurs in the late middle age or in the older age. So in the older age person or late middle age person presenting with chest pain, chest heaviness, sometimes they can have abdominal pain also or shoulder pain also on the both the times. The pain can go to the right or left hand, and usually it is associated with difficulty in taking breath and chest pain along with the feeling of one's heart rate or feeling dizzy. These are all the complaints. Usually all these complaints, these are known as angina. Angina means chest pain, angina pectoris. So these symptoms typically occur when the patient is doing some hard work like climbing stairs, taking big loads, carrying big loads like that. And coming to gastritis, gastritis is a very common occurrence. It is seen in young age, middle age, and also in older age. And usually gastritis is seen in middle age or younger age because of the stress. What are they are like accumulating. Of course, the older age people can also have gastritis, but then the problem comes. In the same group, you can have gastritis and also this thing. Then we have to see this. Usually, gastritis pain is seen in the abdomen and it goes into the chest. Patient will also complaining of belchings. They complain of uh, and also sore taste in the some liquid is coming with sore taste in the stomach and like that. Usually, the background cause is some ulcer or some gastritis is a reason. So we have discussed both conditions overlap. What are these conditions? Heart attack and gastritis. So there is one thing like if you take some antacid and there is a quick relief, it means that it is gastritis. So that is one test. And if the chest pain is not coming down, we have to meet a cardiologist and he will get an ECG done and sometimes and 2D echo also to know the functioning of the heart. But these days, because of the stressful environments, the heart attack is a disease of the old age. It is seen in uh, middle age also. And one more point I want to tell you here is, please remember, this is very important. Uh, if any family member is having heart disease and his age is less than 40 years, there is increased risk for the rest of the family members. And it is better uh, that they get screening in the earlier ages. Okay. So if the patient age is less than 40, it is most likely to be gastritis, then heart attack. And if the patient age is more than 40, it is more likely to be a heart attack. So what are the symptoms? So what do the patients say? Like they complain of abdominal pain, burning, sensation of vomiting, or like they are having vomitings, stomach fullness after eating very small amount of the food. These are the complaints. What is reflux disease? Reflux disease means the stomach contents go inside the chest and they feel chest burning. They also have the same complaint in the throat burning, and there can be change in voice. Some people can have dry cough, and some people can have nocturnal asthma. And when this reflux occurs in the night time, they'll have a disturbance in sleep. This is called nocturnal reflux disease, and because of that their sleep is disturbed and they can develop hypertension also if sleep is not properly going. So what is this gastritis? You can see here the burning red thing, and they complain of symptoms we have discussed. You can see the mucosa. The mucosa is nothing but inner skin of the stomach. This is looking like pale pink color, but here you can see this is a dark pink color here. You can see a dark pink color. And then there are like different conditions. You can have erosive gastritis. Erosive gastritis means there is peeling of the superficial mucosal layer, like when we have cheilitis, when you have like pain in the corners of the mouth. In a similar way, you can have erosive gastritis. Small erosions can occur where, and it can occur throughout the stomach, which is called pangastritis, or part of the stomach in the upper part or in the lower part, it is called antral gastritis. Sometimes there can be ulcers, big erosions, and little bit deeper, they call as ulcer. You can have esophageal ulcer. Esophagus is our food pipe, and this is our stomach. You can have ulcer here, or it can be in the small intestine. So these ulcers, what we have discussed, they are caused by painkillers, these NSAID groups. And these NSAIDs, they also damage kidney. Please remember this. And there is some other infection called H. pylori infection. The infection causes ulcers in the stomach. We have to treat this H. pylori, and we have to completely remove this, or in terms called eradicate. We have to eradicate it completely. Then there won't be any recurrence of the ulcer. Otherwise, if you get your ulcer treated, again, you can have the ulcer again. And sometimes the stomach cancer can also present like an ulcer. That is most important. So what is this reflux disease? As we have discussed, the stomach contents move up into the food pipe, and there it causes the damage to the mucosa or the inner skin. So depending upon the severity, we have grade A, grade B, grade C, and grade D. These are all the these things. And how do we diagnose this thing? We diagnose this by using an endoscopy. See, the doctor is performing the endoscopy where the endoscope is passed to the mouth of the patient into the stomach, and it is viewed on the screen. So what is this reflux disease? We have discussed. So what are the types of reflux disease? We have acid and we have non-acid reflux. Sometimes patient complains of reflux disease and there are changes on endoscopy. This is because the acid is refluxing. Sometimes there is a reflux, but we don't find any changes here. It is called non-acid reflux. Why is this difference important? Because the treatment changes from acid reflux and also non-acid reflux. So there is separate treatment for both the entities. There are distinct entities. So in this case, you can see an elderly person who is having a monitoring device. This device monitors the pH of the gastric fluid, and this is inserted through the nose of the patient, and it goes into the food pipe, and it is lying at the lower part of the food pipe, as you can see here. So normally, as the stomach contents go up as a reflux into the food pipe, the catheter, the pH is monitored, and it will tell whether it is acid or it is alkali or it is non-acid reflux. So depending upon that, we can have a treatment options. So if you see this, this is the outcome of this pH monitoring. We have a composite score analysis. Depending upon this, we can classify whether the patient is having acid reflux or non-acid reflux, because there are different treatments. As we have discussed, you can see this elderly man who has got up in the midnight with a chest pain, and he is holding his arms over the chest like this. Why is this? As you see in this figure, this is a night time, and during this time he is having, when he's recumbent, when he's lying down during the sleep time, he is having reflux. This is known as nocturnal or nighttime reflux. So what are the take-home messages that we should take uh, to prevent this reflux? Is avoid spicy food, smoking or alcohol before sleep, sleep on the left shoulder and use pillow. There were studies telling that sleeping on the left side and it decreases the reflux, and also using a pillow. And we have to have multiple small meals throughout the day. and smallest portion should be before the sleep. There should be a gap of 2 to 3 hours between food and sleep, and a weight loss of 10 to 15%, or sometimes at least 10% is going to improve the reflex. So why is this abdominal pain, abdominal burning, why is it happening to patients? See, this is biopsychosocial conceptual model. This will be very difficult for you, but I still want to impress upon you this concept. The reason is in early life, because of the genetic, cultural, and environmental. See, genetics, it's not under our control. Culture, it's not under our control, but environment is under our control. Like trauma, infection, and parental behavior. When the child is being given strict rules and regulations, or when the parents deal uh, with the child in a harsh way, then what will happen? It is going to affect the physiology. And we can see here the psychosocial factors, life stress, personality trait. You should only achieve more. Achievement is more important than your relaxation. Psychological state, always studying, always worrying about what to do, like that. And what is the coping and coping strategies, like how to deal with so much stress, always in the locked up in the room studying, always in the hostel studying 24 by 7. There is no grandma, grandpa, no uncles to discuss with what is what their problem. And society says that achievement is more important than relaxation. Then lack of social support. If he complains that I am not able to study, people see the child as uh, you see, you are not interested to perform. That is it, because rest of the people are performing, like that it goes. So all this I am able to tell because I deal with lot of such patients in my clinical practice every day. So I don't want this to happen to children. At least I wish that such traits should be kept in mind while dealing with children, so that they don't land in functional GI disorders. Because the psychosocial factors and early life, they are going to impact the physiology with brain gut axis. We have an axis called brain. The brain is going to affect the gut, and gut is being affected by the brain. So it is called the brain gut axis. So they can develop functional GI disorders. That means these are not actually problematic disorders, not actually pathological disorders, but still the patient suffers because it is a problem. So outcome is they meet doctors often, their activities of daily functioning are impaired, the quality of life is impaired, and their healthcare cost is impaired. So I want to share this, though this is a treatment guideline, I want you all to be aware of this. See, this is from the NICE guidelines, UK. Somebody is complaining of dyspepsia or chest pain. Initially, the doctor will do assessment. However, if the age is more than 55, then there is a weight loss and severe abdominal pain, then we'll go for an endoscopy. Uh, so that is the thing. And we'll do a routine blood investigations, and we'll do an imaging if there is an associated mass or tumor suspicion is there, or jaundice is there. There are a lot of differential diagnosis, and you need not remember all this. This is our headache or the clinician's headache. And if I want you to concentrate on the management, the most important thing is decrease smoking and decrease alcohol, and aim to have low BMI, body mass index, and change your diet, small frequent meals. You can have a trial of proton pump inhibitors, or your favorite pantoprazole or omeprazole. And if you're feeling any anxiety, and we have to address it with antidepressants or counseling. I hope now you understand what is the importance of discussing this. So let's discuss what is functional dyspepsia. You can see here a feeling of pain or burning in the stomach. This variant is called epigastric pain syndrome. And we also have a feeling of as if a kettlebell is there in the stomach, or a dumbbell is there in the stomach. This postprandial distress syndrome, feeling of fullness and early satiety. If you see, this is there is overlap between pain syndrome and distress syndrome, and this is under functional dyspepsia, Rome for recent guidelines. This is not a big problem, but it is still a problem that we have to deal. And I hope I've given you a clear message. I tried to summarize and give you some idea about the problem of dyspepsia. If you have any doubts, and I think we can discuss it. Thank you.